This is an introduction to an upcoming video guide to Thai massage techniques for pregnancy. This guide is planned for release in 2019. This video is also an introduction to Noam's new book, Thai Massage Techniques for Pregnancy, Labor and Postpartum. Click on the links below to download 2 free chapters from the book. A few important words before the video begins. Thai massage is the ideal manual method that a woman can hope for in pregnancy, in the birthing room, and in the months that follow birth. The line work, the pressure of key points, squeezing, rotating, mobilizations, and especially the stretches and yoga-like postures are exactly what she needs. Many bodywork practitioners, however, do not treat pregnant women because they are concerned that they may harm the woman or her baby. Those who do treat pregnant women often put many limitations on their treatment. They avoid touching different body parts, they avoid the supine position, and they avoid many of the important stretches and yoga-like postures. In the book, Noam included detailed explanations and discussions of the common pregnancy contraindications. This was based on the assumption that detailed information on the background of these limitations will encourage you to think on your own, make your own decisions, and not automatically accept the formal contraindications. In this short video, Noam will briefly mention 2 pregnancy massage topics, the prohibited points and the supine position in pregnancy massage. For detailed discussion and instructions as to the various pregnancy massage topics, you can purchase the book on our website, www.thaiacu.com, which is thaiacu.com. For a $20 discount, click on the PayPal link below.
Adi is 37 weeks and 5 days gestation. Lying supine, flat on the back, may be uncomfortable, especially as the belly gets larger. Starting after week 20, offer your client the choice of elevating her back. Adi was having contractions from the morning on. We hope that labor will not begin before our studio session is over. During our massage session, the contractions will decrease and then stop. Adi will give birth in 5 days. Foot massage improves blood circulation in the leg. This can relieve leg and foot edema and varicose veins. Foot massage and foot points are central in the treatment of most pregnancy complaints and discomfort. Foot points are used often in preparation for labor, in pre-birth treatment, and during labor. As I massage her feet, I occasionally press points that are considered prohibited by many bodywork practitioners. The green points in these drawings are considered prohibited by bodywork practitioners. However, they are often used by acupuncture practitioners to treat different pregnancy discomforts. You can press them with no anxiety. There is no need to avoid these points. The red points, however, can induce contractions when a woman is ready for labor. They will not lead to preterm birth during a healthy pregnancy before the labor process begins. They can, however, lead to preterm birth of a pregnancy that is at risk. To be on the safe side, consider every pregnant client as having a pregnancy that is at risk. Do not focus on the red points before week 37. We can and should press the red points in every massage as part of our general treatment. However, we should not focus on them with deep pressure, nor for a long period of time. It is safe to have 3 to 4 seconds of soft or medium pressure a few times during a massage session. From week 30, we'll limit the supine position to about 20 minutes at a time. After a foot massage, we switch to the side position. We will continue with the supine position later. I will explain why we limit the supine position shortly. Do not use thumb pressure when working the inner legs. Only use palm pressure. Look for signs of DVT, deep vein thrombosis, before you begin the treatment. You can find more information on DVT and pregnancy in my book. Aortocaval compression syndrome is also known as supine hypertensive syndrome or inferior vena cava syndrome. Some compression of the vena cava in the supine position is seen in week 20 of the pregnancy. However, the syndrome's symptoms usually occur in the last few weeks of pregnancy. This usually occurs after week 36 when the woman is on her back and the large, heavy uterus is compressing the inferior vena cava against the lumbar spine at L4 and L5. This obstructs the blood flow back from the legs to the heart and central circulation. This can result in a loss of 30 to 40% of the effective circulating blood volume and hypotension. This same mechanism may lead to hypertension in obese, non-pregnant clients, including obese men. After working the legs, hip and back in the side position, we can return to the supine position to work the leg lines. We will return to the side position to work the shoulders and arms a bit later. Between 2 to 8% of women may show the typical symptoms of supine hypertensive syndrome. Symptoms usually begin within 3 to 10 minutes after lying supine. As the pregnancy progresses, compression becomes more common. The symptoms may include any of the following: weakness, pallor, dizziness, increased heart rate, nausea, low blood pressure, and sweating. These symptoms resolve themselves as soon as the client changes her position. An ideal position for her is to lay on her left side, as the vena cava is located slightly to her right side. Work the legs, hip and back lines and then return to the supine position. Keep the rest of the side position for later. Even those women who are sensitive to low blood pressure symptoms in supine position will usually have no problem during Thai massage. This is especially the case during the stretches that keep on creating movement, relieving the compression and inducing blood flow in the lower back. When it comes to the mother, the supine position is not really a problem because we watch her and can speak with her. However, we do not see or speak with our other client, the fetus. For healthy babies, the supine position is no problem at all. However, for an unhealthy fetus, such as those with poor growth patterns, a long time the supine position may be stressful. To be on the safe side, limit the supine position to 30 minutes from week 20 and to 20 minutes from week 30. If I had to choose one aspect only of Thai massage to treat pregnant women, my choice would definitely be the stretches. It is said that Thai massage stretches are omitted automatically by most bodywork practitioners. Stretching of the hip joints improves blood circulation in the pelvic musculoskeletal structures and organs, including the uterus and the baby. These stretches improve blood circulation to the legs and back to the heart. They are used to treat lower back and pelvic girdle pain, urgent urination, abdominal pain, constipation, hemorrhoids, and problems that involve poor leg blood circulation, such as varicose veins and edema. Stretching of the hip joints has an additional important role. It helps the women to better feel and be aware of their pelvis, which prepares it for labor. It releases pain and discomfort and makes it more supple. This can help the baby pass through the birth canal with fewer complications. Try to sense moment by moment during the treatment session what your pregnant client needs. Be attentive to her feedback. Learn what is good for her and learn what is not appropriate. Each pregnant woman is unique and has specific needs and limitations. These change in the same woman from one treatment session to the next one as the weeks go by and her belly gets larger. Pregnant women need to feel protected. Our treatment should not be too challenging. Because of mild joint instability, due to the softening of ligaments and cartilage, we should stretch them slowly and not overstretch. Pregnancy, however, is not a disease. Pregnant women seldom suffer from an excess of movement, but often suffer from a lack of movement. They generally love gentle stretching. This video guide will be completed during 2019. Subscribe to find out when the video will be released. Learn about the upcoming workshops on the website. You are welcome to contact me directly with any questions you might have.
The first part of the book discusses the following: maternal physiological changes, complaints and discomforts. Treatment safety. Miscarriage statistics and treatment in first trimester. What are the prohibited points? Labor-inducing acupressure points. The lines of the inner leg and deep vein blood clots. Supine position in pregnancy. Twists, back bends, forward bends, and inversions. Psychological stress and pregnancy outcome. The second part of the book demonstrates general Thai massage techniques and explains the modifications necessary during pregnancy. The third part of the book presents treatment routines for the most common discomforts of pregnancy and postpartum. The third part of the book presents treatment routines for the most common discomforts of pregnancy and postpartum. Painful period, menstrual cramps, insomnia, stress, anxiety, and mood swings, frequent and urgent urination, nausea or morning sickness, exhaustion, fatigue, constipation,